welcome back to the Smart Tea podcast, where we talk about the lives of scientists and innovators who shape the world. I'm Aarati, and today my co-host is my mom. She has graciously agreed to listen to a story. Mom, do you want to introduce yourself?
Hi, I'm Jyoti Asundi, and I'm truly privileged and honored to work with my daughter Aarati. I have great regard for her creative capabilities, her persistence, her absolute dynamism. I'm just so fortunate to have her in my life, and I thank you, Aarti, for giving me this chance to come on to your podcast.
Aw, you're making me blush.
No. I'm honored that I have you as my daughter.
Aw,
So
well, right
thank
back
you,
at you. I'm honored
thank
to have
you.
you as my mom.
I have been a Smart Tea podcast listener for a very long time.
Oh yeah, number one fan.
Number one fan, absolutely.
Yeah.
I just wait for your podcast to be out so that I can listen, and
And I
it's
also
so
wait for you to
wonderful.
listen so that I can
You
hear your opinion. I'm like, this was a great story, wasn't it? Wasn't it? Did you like it? Did you like it?
Yes, yes. I listen to the story, and it's really wonderful because you are with me wherever I go. But
Yes.
a little bit more about me is that I am a scientist and I have a master's in microbiology, and I parlayed that to kind of go through my various work experiences, gathering experience in molecular biology, immunology, and all those protein chemistry and all of that. And I'm currently a biotechie in the Bay Area. So yeah, I'm a biotech
Yes.
person.
We are a family of scientists, our whole
Yes.
family. Yes.
Yes, your brother, my son, has gone off to the dark side of engineering, but hey,
Yes.
you know,
Chemical
he
engineering.
he has his uses. So, but we are
Yes.
the biology people. The
Yeah. He helps me whenever I try to cover anyone related to anything outside of biology,
yes,
chemistry, physics, math. He's required for
he's
that.
our guy. He's our
Yeah.
guy. He has his
Yeah.
uses. We'll keep him.
Yes.
Yes. So tell me, what are we in for today?
Well, today I am very excited for you to listen to this story. I think it's right up your alley.
Okay.
We are going to be talking about a woman scientist
I love
named,
that.
yes, named Frances Kathleen Oldham Kelsey.
Okay.
And she
You know
is,
how I am with names. You know me and
yes,
my problems with names. So what I'm going to do is write this down. What did you say?
yes,
Francis?
Frances. She went by Frankie.
Frankie, I like that.
Yeah, and she just has an incredible story. So I
Hmm.
was writing up this story. It actually turned out to be a little bit longer than my usual stories. And so I was trying to find ways to cut it down, reduce it, but I just couldn't. I like
Nah.
every detail
Yeah,
was
matters.
required. Yeah.
Absolutely.
Yeah. So she is amazing. She is so strong. She worked for the FDA and
Oh, nice.
prevented the thalidomide crisis from coming to the US.
Oh,
Um,
wow.
yeah, so
Oh,
she
that's nice.
is
That's a good
just
story.
amazing.
I
Yeah,
am excited to hear this one. She worked for the FDA.
she did. Yes.
Okay. I'm
Okay.
excited. I'm all geared up.
Okay. Yes.
Yes.
All right. So let's jump into her story.
Yes.
So she was born on July 24th, 1914, in Cobble Hill
Hmm.
on Vancouver Island in British Columbia, Canada, which is a very small kind of rural town. Her father's name was Frank,
Hmm.
and he was originally from Australia,
Okay.
but was living in England
Hmm.
and was part of the British Army and met her mother, Catherine, who was
Hmm.
from Scotland there.
Hmm.
So
Hmm.
they
Hmm.
met in the UK, and then once Frank retired from the army, they moved to Canada and
Hmm.
they had three kids. They had a son named Stuart,
Yeah.
and then Frances was the middle girl child,
Hmm.
and then they had another boy named John after that.
Okay.
So
Nice
she's,
little sandwich.
yeah, sandwiched in there.
That must have been a fun position in the family for her.
I bet it was.
Either she was the boss of everybody or she got
Yeah.
bullied. I have to figure out which one.
I'm kind of thinking she was the boss based on what
Excellent.
I
I
know about the
love
rest
girl
of her story.
bosses. I love
Yes.
girl bosses.
Yeah. So she had an interesting education when she was growing up. She
Hmm.
learned how to read and write by listening in on her mom teaching her older brother how to read and write. So
Yes.
I don't know. It sounds kind of like the mom didn't actually teach her specifically. It was like just she was so precocious that she just
Yeah.
was like, I'm not going to wait until you deem
Yeah.
me to be age
Yeah.
appropriate to learn how to read
Yeah.
and write. I'm just going
This
to,
is like those old village schools also, where they have only one room and 4 to 5 grades are all crammed into. I mean, this is a little bit older. I don't know if it still
mhm.
happens, but in older times they had those like one room school for the entire village and one teacher,
Yeah.
and they would should kind of divide her time between the 20 students who actually managed to show up that day, who were let go from their farming duties, and then
Yes.
all the different grades were in the same class. The teacher had to manage, and then the 4-year old child knew more than the high schooler because of this kind of situation.
Yeah, I think we had another woman scientist who was the same. I think it was Stephanie Kolek who was the same way, who just learned from the higher grades. So
Yes,
I think that's kind
yes,
of what's going on here.
yes, yes.
But she did go to school. Theoretically, it was an all boys school, but Frances, for whatever reason, was allowed to attend. I couldn't figure out why they made an exception,
Maybe she
but
cut her hair and wore a cap and
yeah,
said, I'm a
who
boy
knows?
and I'm actually Frankie.
Yeah,
What do you mean
yeah.
I'm a girl?
She
Who
was
said
just
I'm a girl?
masquerading. So she said that being in this kind of environment from such a young age is really what set her up to be comfortable in a very male dominated career later.
Yeah,
So I
yeah,
can totally
yeah.
tell that.
I can make out that. So it was good she was sandwiched between two boys.
Yeah.
She learned how to
Yeah,
navigate.
she has two brothers. She's going to an all boys school.
Yeah,
Hmm.
she learned how to navigate that world. Awesome.
Yes.
Awesome.
So outside of school, she also learned painting, piano, modern dance,
Wow.
and a friend of hers also taught her how to hunt, fish, and drive a car, all without her parents knowing about it.
Oh,
So,
I'm impressed.
yeah, I thought
I'm
that was
impressed
funny.
the fact that she is such an all-rounder.
Yeah.
Wow, nice.
She did really well in high school and then graduated when she was only 15 years old. At this point, Frances had decided that she definitely wanted to pursue higher education, but she
Yeah.
was a bit young to be running off to university. She's only 15.
Yes.
And so her high school was talked into offering her a senior matriculation year. So
Oh,
Frances could start doing her first year of college at the local high school.
okay.
So that was nice. So Frances had decided she wanted to major in science, but
Mm-hmm.
she had struggled a bit with chemistry.
Mm.
And so she thought, maybe chemistry is not for me. I want to try biology. But to her disappointment, her high school didn't offer biology, which I
Mm.
thought was so strange. Luckily, though, the summer before she went back to participate in this senior matriculation year, she met a Dr. Anthony Kingscote, who was
Mm.
a parasitologist who just happened to be on holiday in her area.
Oh.
And so he heard about her interest in
Mm.
biology. And so
Mm.
he met with her to give her kind of like an overview on the
Mm.
subject
Mm.
and told
Mm.
her that if she wanted to major in anything related to biology, she needed to start now. She needed to
Mm.
like
Mm.
do her first year of college or her first year of senior matriculation. She
Yeah.
had to take a biology course if she
Yes.
wanted to pursue it in college.
Mm. Mm.
But again, her high school didn't offer it. So it was arranged that Frances would be able to drop her Latin course and
Ah,
instead travel to Victoria College just to take biology.
good. That
Yeah.
was nice and accommodating. Okay.
Yeah. They
Yeah.
figured it out.
Yeah.
She kind of stuck out on the college campus because all the other students were like really dressed up nicely and
Yes.
she was in her high school uniform. But,
Yes.
so it was like really obvious that
Yes.
she didn't belong, quote unquote. But other
Yes.
than that, totally worth it. She loved it.
Yes. Yes.
And so the next year, her following year, she went to Victoria College full time. And then after that, she transferred to McGill University.
Oh, nice.
And here she was able to take more specialized courses. So, on the advice of a friend, she takes her first biochemistry and pharmacology classes
Mm.
and
Mm.
absolutely loves it.
Mm.
But when she graduated, it was the middle of the Great Depression. And so, although Frances looked around for a research lab job after graduating, it was impossible for her to get one. Any open positions were always given to men,
Of course.
of course, but
Yeah.
actually, Frances did not see this as sexist. She really kind of understood that this was a time when men were considered the breadwinners of the family. And so it
Mm.
absolutely made sense to her why a paying position should go to a man over
Okay.
a woman. So
Yeah.
she was like, I
She's,
get it.
yeah, because she lived in those times. That's how
Yeah.
life worked. That was the
Yeah.
model by which we lived life in those days.
Yeah. And so she didn't get mad about it. She was just
Yeah.
like, I totally get it. She said, this is funny. She said, quote, this situation led me to realize that my choices were either to do graduate studies or to join the breadline. Those were about the only alternatives in those days, and I decided graduate work would be more interesting.
Oh
End
my
quote.
God. When you say join the bread line, you mean like stand
Like
in line with your hand
unemployment.
out, with for a
Yeah.
handout and
Yeah. For
unemployment.
like,
Oh my
yeah, like
God. So she
welfare.
chose grad school because grad school is better than being in the
It's more
unemployment line.
interesting. Yeah. It's
Okay.
more
Okay.
interesting
Oh,
than,
yeah.
being
Yeah, I can
unemployed.
vouch for the fact that grad school is probably more interesting than the
Yeah.
unemployment line. Sure.
Probably.
Yeah,
Yeah.
probably. There might
Yeah.
be something more interesting in grad school.
I
Oh my
just
goodness.
loved her
She
attitude.
has, yeah, she just like, okay, life is giving me lemons, just make a lemonade and take it.
Yeah. So she went back to the biochemistry department at McGill and she was looking for graduate student positions. She was particularly interested in studying the endocrine system, which is the study of our hormones.
Yes.
But unfortunately, all the graduate student positions were already filled. But one professor suggested she try the pharmacology department instead because there
Mm,
was a pharmacologist there,
mm,
Dr. Raymond Steele,
mm.
who was working on the pituitary gland, which is a small endocrine gland located at the base of your brain, just below the hypothalamus. The only catch was he didn't like taking on graduate students. But
Oh,
Frances was like, I might as well try.
yes.
So she went up to Dr. Steele, explained her situation and how fascinated she was by the endocrine system. And to
Hmm.
her great surprise, Dr. Steele agreed to take her on for 1 year.
She had the power of
Yeah.
persuasion. All
Yes,
right.
she does.
She knows how to get what she wants.
Yeah. Very persistent, very determined.
Nice. So, like someone I know.
Really. After a year, she got her master's degree, but once again, she still didn't have any job prospects. A year
Hmm,
didn't change anything.
hmm,
So Dr. Steele said he would continue to pay her $50 a month as a research assistant, which back
hmm.
then was enough to live on. Um,
Good times.
yeah, yeah,
$50 a month was enough
$50.
to live on. Oh,
Yes,
nice. $50 is pretty good.
yeah,
He's impressed by her. Obviously, Dr. Steele is
yeah.
impressed by her.
The only condition was like she had to actually try to move on and like look for
Hmm.
opportunities. So
Yes. Hmm.
he was like, I'll keep funding you, but you need to move on at some point.
Find
So
a different
work
place.
on
Yeah.
that. Yeah.
Yeah.
In 1936, Dr. Steele heard of a new pharmacology department opening in the University of Chicago.
Hmm.
So he told Frances to try her luck there.
Yes.
So she wrote a letter to the chairman, Eugene Gayling, and she was very surprised to receive a letter back saying, Dear Mr. Oldham, if you can be in
Oh.
Chicago by March 1st, you may have the research assistantship for 4 months and then a scholarship to see you through your PhD.
Oh,
Please
wow.
wire immediate decision.
Oh,
So
wow.
Frances,
What? Okay. Hmm.
so yeah, what are we going to do? Frances showed the letter to Dr. Steele and
Yeah.
asked whether she should clarify that her
Yeah.
name was the feminine Frances with an E
Mm-hmm.
and
Mm-hmm.
not the masculine Frances with an I, because
Yes.
she knew it was very likely that Dr. Gayling didn't realize that she was a woman. And that's why he was immediately saying, Yes, come, we'll fund your PhD, we'll take
Hmm.
you
Hmm.
on.
Hmm.
So she's like talking to Dr. Steele, like, what should I
Hmm.
clarify this? And Dr.
Hmm.
Steele's like, quote, don't be ridiculous. Accept the job. Yeah,
Oh,
accept
nice.
the job, sign your name, and
Yes.
put Miss in the brackets afterwards and go.
Yes.
Yeah.
Go. Oh,
Yeah.
good guy. Good advice.
Yeah.
Good advice. the
Yeah.
the reality is lost in translation. Take advantage
Yes.
of it. Yes, make if you can't get in through the door, jump in through the window, no
Yeah.
problem.
You said
Wow, nice.
yes. I'm
Yes, you
here.
said yes,
Yeah.
I'm here. I took
Yeah.
the train and the bus and the boat and everything. And
Yeah.
now I'm here, and now
And
you
now
can't
what are
send
you
me
going to
back.
do? I'm on your
Yeah.
doorstep.
Yeah,
Like, you
and
can't
you
send
can't
me
send me
back now.
back.
I'm
You
here.
can't send me back.
Yeah.
Fantastic. I
So,
love that advice. Just grab
yeah.
opportunity when it knocks on your door, even if
Yeah.
it's wearing a little bit of a mask or whatever, no
Yeah.
problem. Go
Don't
for it.
second guess it. Just take
Yes,
it.
yes. Move it, move
Yeah.
it. Yes, yes,
Yeah.
yes.
So that's
Nice.
exactly what she did.
Yes.
Frances went to Chicago and
Yeah.
she said that Dr. Gayling never owned up to whether he actually made a mistake or not, although she was
Oh,
pretty sure.
I love that. I love
Yeah.
that. I love that he kind of went with the flow. He's
Yeah.
like, oops, it's a girl, but I knew that all the time.
I meant to do that.
I meant to do that.
Yeah.
Nice. I like
Yeah.
it. So she
Yeah.
got in
Yeah. She got
and she
in.
stayed in.
Yeah. But she
Yes.
was pretty sure that if she had had a name like Elizabeth or Mary or something, she would not have been accepted because
Yes.
Dr. Gayling actually turned out to be a very conservative, traditional kind of guy
Ah,
and didn't really approve of women scientists.
ha ha ha.
But I also found it pretty ironic that Frances was his first PhD student.
Wow, how life plays games.
Yeah.
It's ironic. It's truly ironic. Fun.
Yeah. So, for her PhD thesis, Frances worked on the anatomy and pharmacology of the posterior pituitary gland of the nine banded armadillo.
No way. Where did she find an armadillo to
That
study?
is a great question.
Oh
So,
my God.
the reason she was studying armadillos is because at the time, endocrinologists were trying to determine where in the pituitary gland certain hormones came from.
Mm,
And in humans, the pituitary gland is kind of separated into the anterior and the posterior lobes, but the two
yes.
lobes are still connected.
Mm-hmm.
So when a hormone is being formed, they don't know if it's being formed in the anterior or posterior because if it's being formed in the posterior, it can kind of travel over to the anterior and vice
Yeah.
versa. So they're
Mm,
not sure.
yes.
But in some animals, like the armadillo, the two lobes of the pituitary gland are completely separated,
Mm-hmm.
which makes it easier to differentiate where the hormones are created.
Yeah.
So it was absolutely a weird model organism, but very useful in
Yeah.
this
I'm
particular
just
instance.
thinking of how the heck did they go study the pituitary gland of every single animal until they found the armadillo
I feel like they must, like somebody else must have been studying armadillo
for some
anatomy
other
for some
reason, and it
reason, like
was
a
kind of
zoologist
known.
or something.
Yeah. Yeah.
It must have been kind of known that there are just a few animals that have,
Yes.
and I bet it was something like, well, we can either try to study whale sharks or we can try to study armadillos. I
Yes,
guess.
and we can
Yeah.
travel less to find an armadillo. Yeah, yeah.
Yes.
All
Yeah.
right.
So she finished her PhD in 1938, and then she spent 1 year as a postdoc studying how the pituitary gland in armadillos developed. And for that, she needed to study armadillo embryos. But
Oh,
you can't breed armadillos in the lab. So
yeah.
she had to fly down to Texas to get them from an armadillo farm.
Oh my God.
So
Okay.
I know she spent a year doing that.
Man.
Okay, so now we're getting into the actual meat of things. So
Yes.
while she's working with Dr. Gayling,
Mm-hmm.
she gets her first exposure to working with the FDA. So
Huh.
at this point, the FDA is only about 30 years old. And if our listeners remember back to episode 22 of the podcast from last year, the founder of the FDA, Harvey Wiley, was largely focused on making food safe. So there wasn't really a lot of focus on drugs and certain chemicals. It was more about let's make sure there's no brick dust in your cinnamon spice and, things like that,
Yeah.
no chalk in your flour.
Yeah.
There was some understanding that there are certain substances like heroin, morphine, cocaine, and alcohol, which were very addictive, and those could be dangerous. So those things had to be labeled if they were included in medicines, but that was really about it in terms of regulating these things. So in
Hmm.
1933, so this is
Hmm.
jumping back just a couple
Yeah,
of years,
got it.
a new drug called sulfanilamide was
Hmm.
introduced in Germany
Hmm.
as an antibacterial to fight pneumonia and
Hmm.
streptococcus infections.
Okay.
And it was incredibly successful, and
Hmm.
people started using it all around the world, even though there hadn't been much scientific research on it.
Oh.
The big problem arose when one manufacturer tried to change the formula to market sulfanilamide to kids. So,
Oh.
sulfanilamide is not soluble in water or alcohol, but
Okay.
apparently it's soluble in diethylene glycol, which naturally has a sweet taste. So he was like, great, we're trying to give this to kids. Diethylene glycol has a sweet taste. Nailed
That's
it.
pretty toxic, I think.
It is highly toxic. It is the
Yeah.
main component of antifreeze.
Yeah.
Yes.
I was trying to, my brain was not connecting. Oh my God. So
Yeah.
you're
So,
basically giving kids antifreeze now,
yes.
or
Yeah.
even people were.
Yeah.
Wait a
People.
second. So
Yeah.
so wait a second. So people were taking sulfanilamide
Yeah.
in dissolved in antifreeze, and then they were like trying to move that over to the kids.
No, so they were taking sulfanilamide like as a pill or in some
Oh,
other form because like adults
oh,
can swallow pills.
okay, okay.
Yeah.
So adults were not being given sulfanilamide in antifreeze. Okay, okay,
Originally
but
not.
the kids cannot swallow pills, and so now you're trying to make a syrup out of it.
Yes,
And wow, look at
exactly.
this sweet little thing,
Yeah.
diethylene glycol. Kids
Yeah.
will love that. Of
Yes.
course. Oh goodness,
Yes.
no way,
Yeah.
no way, no
So
way.
he mixes sulfanilamide with diethylene glycol and some strawberry flavor, and all
Oof,
the kids love it.
of course.
And the adults love it too, because why would you want to take a pill when you can have strawberry syrup, right? Like, you know,
Oh
absolutely.
man,
So then, predictably, people start dying.
yeah.
So now the FDA is scrambling because they legitimately don't know what is causing this. They don't know whether it's the
Because they haven't
sulfanilamide.
done any testing.
Right.
People are eating and drinking drugs and
Yeah.
medicines, and they have absolutely no clue what's going in, how toxic it is.
Yeah.
Oh, fun times. Okay.
Yeah. So they legitimately don't know whether it's sulfanilamide or diethylene glycol or maybe it's the strawberry mix flavor. Like they have no idea.
Mm,
So they call Dr. Gailing to
mm,
help, and he
mm.
puts everyone in his lab, including Francis, on various projects around figuring this out.
Yes.
And so Dr. Gailing sets up a number of animal toxicity studies in dogs, rats, and rabbits.
Mm,
And Francis was in charge of watching the rat study.
okay.
So they set it up so that the animals either got sulfanilamide alone,
Mm-hmm,
diethylene glycol alone,
mm-hmm.
the strawberry flavoring alone, or the full mixture that was on the market.
Yes.
And sure enough, the animals that got sulfanilamide or the strawberry flavoring alone were fine, but it was the animals that got diethylene glycol alone or the mixture that was on the market, their kidneys would rapidly shut down and they would die.
Yes. Good Lord.
So, this work directly led to a new law in 1938 known
Mm,
as the Federal Food, Drug, and Cosmetic Act, or FDCA, which basically empowered the FDA to test, regulate, and pre approve the safety of any new drugs before they could go on the market. So,
which, oh, key, absolute requirement.
yeah,
Hello.
yeah,
You need to test it before you let anybody randomly eat it. Oh,
yes,
wow.
yeah,
Hmm.
yeah.
Those were fun times, obviously. Hmm.
Yeah, and so Francis contributed to that, law
Nice. Yeah.
happening in a
Yeah.
small way,
Yeah.
and this really gave her the first clear understanding of like why drugs need to be regulated and tested for safety before being sold.
Yes.
So, after finishing her postdoc, Francis joined the faculty at the University of Chicago. And at this point, many pharmacologists were looking into cures for malaria, which was widespread during World War II. Japan had invaded and taken over the Dutch East Indies, which was where most of the world's supply of quinine, which is
Yeah. For anti-malaria. Yeah.
Yeah,
Yeah,
where
yeah.
that comes from.
Mm-hmm.
So, since Japan had taken that over for the Allies during World War II, they no longer had reliable access to quinine.
Mm-hmm.
And so, pharmacists were looking for a synthetic replacement.
Mm-hmm.
And all across the US, pharmacists tested over 14,000 potential drugs over the
Okay.
span of 4 years from 1941 to 1945.
Looking for a quinine equivalent against malaria. Hmm.
Yeah.
Hmm.
And they weren't successful, but through studying these drugs, Frances learned more about how certain drugs were metabolized. And one of the most interesting and pertinent to the story things that she observed was when they gave certain drugs like quinine to
Hmm.
pregnant animals,
Hmm.
sometimes the drug would pass through the placental barrier, but
Ah,
the fetus wouldn't be able to metabolize the drug the same way the mother could because their
yeah.
organs hadn't fully developed yet.
Yes. Yes.
And so Francis, in fact, ended up co authoring a paper about how quinine was metabolized in embryonic rabbits with
Mm-hmm.
another faculty member, Fremont Ellis Kelsey.
Mm-hmm.
And Fremont Ellis Kelsey ended up marrying her in 1943.
Oh,
Yeah.
nice. Okay. Like minds. Mm-hmm.
Yeah.
Mm-hmm.
But this actually posed a bit of a problem because at the time, it wasn't allowed that two family members were employed by the same department
Oh,
at the
wow. Okay.
University of Chicago. So, what would you do? You
Go to the FDA and ask them, hello, I'm Francis
Yeah.
with an I. Can you
Yes.
take me?
Francis.
Can you take me in? And in the bracket, I'll write Mrs. now,
Yes. You
or
could
even
apply for
write,
a job.
I'll apply for a job at the
Yes.
FDA.
Yeah. Which would maybe be logical, but
Hmm.
Frances decided to take another route. She
Ah,
decided that the most logical way out of this was for her to go to medical school.
oh, she's
Yeah.
very ambitious. Fantastic.
Yes.
Good for
Yes.
her.
So she's
Yes.
already got her PhD, she's done her
Nice.
postdoc, she's been
Nice.
co-authoring these papers,
And
and
she says, I need to learn more.
yes.
This is just
So
not enough what I have done so far.
and she thought it made sense because she was like, I've been studying so much about biochemistry and, anatomy and things like that, even just in general to figure out how certain hormones move around your body and how certain drugs are metabolized. So she kind of felt like she probably would already know what was taught in the first 1 or 2 years of medical school. And so that would give her a leg up over the other mostly male students.
Yes.
And even though she didn't actually plan on practicing medicine, if she joined the University of Chicago Medical School, her
Hmm.
husband could continue working as a faculty member and then they could stay together.
Yes.
And plus, she figured if she had an MD and a PhD, people might take her more seriously as a woman in the field.
What
Yeah,
hoops you have to jump through
I
to be
know.
taken seriously as a woman. Wow.
Yeah.
A PhD, a postdoc, papers.
Yeah.
No, I need a medical degree to be taken seriously. All right.
Yes. So while she's in medical school, she has two daughters, Susan and Christine.
Mm-hmm.
And based on what she knew about from her work, she was very, very careful about what she consumed during her pregnancies, which
Yeah,
included
smart
no
woman.
smoking and no drinking.
Yes.
And this was 20 years before people knew about fetal alcohol syndrome. So
Hmm.
she's way ahead of her time here.
Good for her. Hmm.
She graduated in 1950, and
Hmm.
because of the connection she had made in Dr. Gayling's lab, she had a job lined up for her as an editorial associate at the Journal of the American Medical Association, or JAMA, working under Dr. Austin Smith.
But now she's a doctor and she's being on the editorial board of things.
Yes, so
Yeah.
she's
Okay.
working like as an editor at a scientific journal.
Okay.
Yeah.
Hmm.
So, Dr. Smith was particularly interested in publishing articles about new drugs that were
Hmm.
coming onto the market. And so,
Hmm.
Frances was tasked with reading through these manuscripts and evaluating how thorough the science was.
Hmm.
About 2 years later, Frances's husband got an offer to head the pharmacology department at the University of South Dakota Medical School in Vermillion
Hmm.
after the previous head passed away.
Mhm.
So the family decided to move to South Dakota,
Okay.
but Frances then had to figure out what to do about her job,
Yeah.
because again, women were, not really given positions very easily. And so Frances was like, well, I can either go to law school or I could do a
Oh,
medical internship.
wow.
So thankfully, she chose the internship.
Okay.
The fact
Oh,
that I know
oh my gosh.
the fact that she even considered law school was
Yeah.
like,
After all this, she's like, I can do law.
yeah,
Wow.
yeah.
My God.
Yeah. So
Hmm.
thankfully, she chose the internship at the Sacred Heart Hospital in Yankton. And
Hmm.
then afterwards, she was awarded the Leaderly Teaching Fellowship, which supported faculty members to pursue any kind of research they wanted.
Hmm. Hmm.
So at the time,
Hmm. Hmm.
radioisotopic drugs were
Hmm.
becoming very popular.
Hmm.
So she started learning about that. So every so often, she would commute overnight to the University of Chicago to get training on radioisotopic drugs. She would
Hmm.
stay there for 2 to 3 days, and then she would
Hmm.
head back to Vermilion, South Dakota.
How far is that?
That is a good question. I don't know. Let's see. Let me
Because
look it
these
up.
are days where you don't have airplanes to
Yeah,
just
she's
whiz
going
back
by
and forth.
yeah, she's
She's
going
either
by train.
train, is it? Or at least trains were there
Yeah, so it's like a 8-hour car ride. So
today.
I would say, yeah, today it would be an 8 hour. Yeah, I would say at least probably 12 hours by
Yeah.
train.
Oh, more.
And
Yeah. More.
so
Yeah.
that's why she would probably stay there for 2 to 3 days.
Makes sense.
It said
Hmm.
she would commute overnight to the
Okay.
university. So
Okay. Okay.
I
All
guess
right.
yeah, at
Yeah.
least 10, 12
It's like
hours
taking the red
probably.
eye. It's like
Yeah.
taking today, you take the red eye like that.
Yes. But because she did this, she
Mm-hmm.
became the first person, not the first woman, but the first person to get licensed to use radioisotopes in medicine in South Dakota. Yeah.
Nice.
So she's just nailing it.
Hmm.
After her fellowship, Frances spent a few years practice sitting, which
Hmm.
basically meant that when some physician in South Dakota needed to leave their clinic to go to a meeting or take a vacation, she would fill in.
Yes.
And this worked out really well for her because she was able to stay home most days with her two
Mm-hmm.
young daughters.
Mm-hmm.
And it also gave her a lot of variety in the types of medicine she was able to do. So it kind of rounded her out as a physician because until now she's been like doing a lot of drug and medication type of things into these like diseases like malaria and things like that. And now it's like, oh, this little boy came in with a broken bone,
Yeah.
or like someone has a case of the measles.
Yeah.
Yeah.
Giving her a broad perspective on what medicine is all about. Yeah. Got it.
Yeah. Hi, everyone. Aarti here. I hope you're enjoying the podcast. If so, and you wish someone would tell your science story, I founded a science communications company called SciComm, that's SYKOM, that can help. SciComm blends creativity with scientific accuracy to create all types of science communications content, including explainer videos, slide presentations, science writing, and more. We work with academic researchers, tech companies, nonprofits, or really any scientist to help simplify your science. Check us out at SciCommer.com. That's SYKOMMER.com. Okay, back to the story. So then in 1960, nearly simultaneously, both Frances and her husband got job offers in Washington, D.C.
Hmm.
Frances's offer was from Dr. Ralph Smith, who offered her a position as a medical officer at the FDA to review new drug applications. So at this time, the way it worked was when a company had a new drug that they wanted to sell, they would submit a new drug application or NDA.
Mm-hmm.
Each NDA was reviewed by a team of 3 people. There
Hmm.
was a chemist who looked at what the drug was made of and all the ingredients and their properties, a pharmacologist who reviewed the animal studies and
Yes.
toxicity,
Mm-hmm.
and then a medical officer who reviewed the human clinical trials to determine safety and efficacy in people.
Okay.
The team had 60 days to review a new NDA, and
Hmm.
at the end of 60 days, they had to either reject it or approve it.
Oh, goodness.
And if they didn't reject it,
It was considered approved?
yeah, automatically approved.
Hey, wow, things were different. Things are not done like that today. I mean,
Yes.
the important pieces are there. The animal. I'm glad they had the animal testing and the human testing, but
Hmm.
the FDA can take as much time as it wants. It's this is not
Yeah.
right. Yeah. Okay.
Yes.
Wow. There's
Yeah.
lack of stringency there. So
Yeah.
it's basically favoring the drug makers. Actually, than that law. I'm in drug development, so I would like that, but no, the stringency is required. You have
Yes.
to make the drug, you have to put the drug through its paces and figure out its full toxicity and its all its mechanism of action, side effects and everything. Can't just be like, yeah, let's go with this.
Yeah. This process is a lot more intense today, has a lot more oversight and requirements. So Frances started at the FDA in
Mm-hmm,
August 1960,
mm-hmm.
and she was looking over the clinical trials portions of the NDA. She was a medical officer.
Okay.
And a month later, 1 month later, in September 1960, she was handed an NDA from the William S. Merrill Company in Cincinnati for a drug called thalidomide.
Hmm.
So, thalidomide was already being sold in Germany and was marketed as a sedative and was also being used to alleviate morning sickness in pregnant women. And it had originally been sold over the counter, but later had become available by prescription only. That'll
Over the
become important.
counter. How did thalidomide get over the counter status?
Yes.
Good Lord. And for it to go absolutely backwards, that's absolutely backwards, where
Yeah.
you're first over the counter and then, oh, wait a second, we'll
Yeah.
add some regulation to it. Let it be by prescription only.
Yeah.
And a drug like thalidomide that I think many people might have heard of because it has a horrible, horrible history.
Yes.
So women in Germany are
Yeah.
being able to either go to the doctor and get it as a prescription, or maybe
Hmm.
even, hey, over the counter, I'm pregnant,
Yeah.
I need something for my morning sickness and I want a sedative. Let me
Yeah.
go get thalidomide. Wow. Okay.
Yeah. And so
Nice.
that's exactly how it was being treated. So
Hmm.
Francis's bosses figured, oh, thalidomide being sold in Germany, this is going to be a really easy case for her to handle. She's only 1 month in. She's still getting her feet wet. Let's give her like a really easy NDA that she can just like look
Easy.
through and, like this is going to be super
Wow.
easy. Yeah.
Ha.
So they're still trying to ease her in. They think they're being nice. Yeah.
Ha.
Right off the bat, all three people on the team, the chemist Lee Geismer, the pharmacologist Jiro Oyama, and Francis, all had problems with the NDA.
Thank goodness.
Yes. Interestingly, Francis's biggest problem was that the clinical trials just looked too good. A lot of the so-called data were more testimonials from doctors rather than actual scientific or clinical
Oh,
lab data.
what? Wait,
Yeah.
what? Hang
Yeah.
on. I
Yeah.
was actually just going back in the story just slightly. You said
Yeah.
the FDA had three people looking
Mhm.
at the animal testing and then the clinical data.
Yeah.
And I thought, okay, that's very comparable to what we have today.
Mhm.
No way
Yeah.
is clinical data comprised of
Ye
testimonials from
yes.
doctors today.
Yeah.
No way does that happen. You
Yeah.
have very regimented what studies are called dose escalation studies today.
Mhm.
And what that is you start off with what is called as SAD. It's called a single ascending dose. So you
Mhm.
start with the smallest possible amount and then you
Yeah.
watch and give only one dose and you're done, one and done. That's it.
Yes.
And if the person is okay and you have a certain set amount of time that you wait for them to not keel over, not
Mhm.
show side effects, then after all the data has come in on patient number 1, then you go to patient number 2, somebody completely different person,
Yes.
and they are given slightly more. So if you started, say, for example, at 5 milligrams per kilogram or 5 mg per kg, then
Mhm.
you go to the next level, 10 mg per kg. And you do the
Mhm.
same process again and go on. And then you go through the whole thing until you reach where you know you need to be to
Yeah.
actually get to the point where you have efficacy.
Yes.
There is a point, you know fully well when you start at your single ascending dose, the whole
Yeah.
thing,
You know you need to get to 100.
you need to
Yeah,
reach
but you're
100.
starting at
5
5.
is not going to do anything, but you start at
Yeah.
5, and then you slowly go up step by step by step until you reach 100, and you give
Yeah.
this last person the 100, and you watch them and you get all the things in, and then you say, okay, now let's do the second phase of it, which is
Mhm.
multi-ascending dose. And then they are again, you start back at 5,
Yeah.
because this time you're given 5 multiple times over a
Yes.
certain amount of time. And then if that is okay, then you kind of say, okay, this person can now go to 10, and then you can go to 20, like that. There's such a regimented way of doing
Yeah.
this.
And this is
And
all after animal studies too.
yeah,
Like
yeah, after all the
the
animals,
animal
yeah.
has to be okay
Yeah,
first.
the animals, and it's
This,
not
yeah.
one animal,
Yeah.
because there
Yeah.
is so many cases where everything looks good in one species, actually, like
Mhm.
humans versus rodents, like that.
Yeah.
The rodents may be fine, but then you kind of have to go to some other, like, say for example, dog or
Mhm.
something,
Yeah, but something with a different system. Yeah,
something
because
with a different system. You have to try
yeah.
different systems, because the metabolism, the way the drug passes through our systems, is very different in different species. So you
Yes.
can't just be like, oh, I'll give it in some ants, and oh, the ants did not die and everything is fine. Oh, the
Yeah.
fish were okay afterwards. No, that's not how it works. You have to give
Yes.
it properly. Oh my goodness.
Yeah.
Testimonials. So you were saying to
Yeah.
me that they were going off based on testimonials from doctors. Oh,
Basically, like the
good Lord.
clinical lab data was like some doctors saying, "Yeah, we gave it to a patient. The patient responded
The patient didn't
favorably,
worked
worked
and they,
great." Yeah.
oh,
Like,
wow, wow,
yeah.
no way, no way.
Yeah. So all three people on the team reported that the NDA was deficient and needed to be resubmitted with more information.
Hmm.
So Merrill, the company who's submitting the NDA, resubmitted again, but all three still found it deficient and sent
Hmm.
it
Hmm.
back again.
Hmm.
Then, in February of 1961, Francis was shown a letter by Dr. Leslie Florence in the British Medical Journal that had been published a couple of months prior, in which he wrote that when he treated patients with thalidomide, they developed negative side effects like peripheral neuritis, which is a
Yeah.
painful tingling in the arms and legs.
Yes, yes.
It was pretty severe and often irreversible,
Hmm.
especially if the patient had been taking thalidomide for a long time.
Hmm.
So Frances and her team wrote a letter to Merrill citing this letter that
Mm-hmm.
Dr. Leslie had given them. And they asked for more proof that this drug is actually safe.
Yes.
But it turned out that Dr. Leslie Florence was not the first one to report peripheral neuritis as a side effect of thalidomide.
Huh.
And it turned out that Merrill, the company,
Yeah.
actually knew about this.
Ah, they had
Yeah.
suppressed it.
Yeah.
Oh my
They
goodness.
rather, so this is where rather than pulling the drug from the market, they had
Yeah.
just decided to make it available by prescription only. And
Oh my
that's
God.
why it got pulled back from being,
No way.
yeah, over the
Oh
counter
my
to
God.
prescription only.
They knew of the problems,
Yes.
and yet allowed so many women in Europe to continue to take it
And while this is happening, they're actively trying to push the thalidomide into the US
into the
markets.
USA.
Yeah.
Wow. Oh, I'm so
Yes.
glad we had such strong gatekeepers so early on.
Yes. So Francis's like to that point, Francis's contact at Merrill was a Dr. Joseph Murray,
Hmm.
and he was getting more and more annoyed that
Of
Francis was
course.
not just approving the drug.
Why don't you
Yeah.
just roll over and
Yeah.
say yes?
Yeah. Come
Why?
on.
Why are you using
Irritating
your
woman.
brain? Yeah,
Yeah.
you irritating woman. Why are you using your brain? Nag, nag,
Yeah.
nag. Oh
Yeah.
my God. Why do you have so many questions?
Yeah, he had thought getting approval in the US was going to be like really easy since it was
Hmm.
already being marketed in Europe. But Francis just kept on delaying it, kept on asking for more clinical studies and more scientific data.
Good for
And
her.
he tried to reassure her that the side effects were not common and probably due to extenuating circumstances like pre-existing conditions that the patients had. But Francis was not buying it because, from her perspective, it was really obvious that he knew about these side effects and deliberately
Yes.
had left them out of the NDA
Yes.
application.
And the fact that you lied once casts a major pallor on everything else you're telling me. You
Mm-hmm.
are trickle truthing. He's basically trickle truthing her.
Yes.
Yes.
And so then they tried another tactic of comparing thalidomide to the harmful effects and sometimes lethality of barbiturates, which was
Oh.
also being marketed as a sedative.
Hmm.
So, unlike barbiturates, it didn't seem like people could overdose and
Hmm.
die from taking thalidomide.
Hmm.
But Francis was like, saying at least it won't kill you like
Hmm.
barbiturates will is a
Yeah.
pretty terrible argument for,
Yes.
yeah, letting it go
Yes.
through.
Absolutely. Yeah.
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 So, because of these reports of peripheral neuritis, Francis and others at the FDA became curious about the effect of thalidomide that it might have on fetuses because so many pregnant women are taking this and it is being
Yeah.
marketed towards pregnant women.
And she has this previous history where she has actually studied that when something is ingested by the mother, the
Yes.
baby armadillos are not
Yeah.
doing the same thing as the
Yeah.
mother. And
Rabbits, quinine in
rabbits,
rabbits. Yeah.
yeah, quinine, sorry, thank you. But she has done this before, where
Yes.
the what's ingested does go through the placental barrier and is not treated the same way by the fetus as the mother metabolizes it differently than the fetus.
Exactly.
Good for her. Wow, she's piecing it all together.
Piecing all of her knowledge together.
Knowledge
And
together, yeah.
yeah, and this is being marketed towards pregnant women. So she's
Yeah.
like, what is it doing to the fetus?
Yes.
And that hasn't been properly studied.
Yes.
So the FDA asked Merrill, the company, to conduct this type of study,
Hmm.
but they were not willing to.
They probably already knew something.
Yep, they probably did.
Yeah.
They agreed to putting a warning label on the drug saying pregnant women shouldn't take this because the
Yeah.
side effects on babies was unknown. So that was the
Smoking is
only,
injurious to. Oh,
yeah,
how
just
interesting.
so
I
you know.
smoking.
But if you
Yeah.
want to do it anyway, we can't
Take it.
stop
You'll
you.
feel so
Yeah.
much better. You won't have the morning sickness.
Yeah.
And I'll tell you, as a mother,
Mm-hmm.
I I would endure any problem I would endure any difficulty. Morning
Yeah.
sickness is nothing compared
Yeah.
to the health of my child. If
Yes.
somebody said to me, take this drug and you'll feel better today,
Mm-hmm.
but your child may or may not be okay. As a mother, no way. It's like a no-brainer. It's like, no, I'm the mother. I will sacrifice anything to make my child healthy, happy, vigorous.
Yes.
Yeah.
And
So
that just makes
man,
it more insidious, I feel like, because if they
yeah,
knew something was up
yeah,
with this drug and doctors are saying, no, it's totally fine. You can take this drug. You'll be
yeah,
fine. Your baby will
yeah,
be fine. And this
and
unsuspecting mother is
yeah,
like trusting the system and is
yeah,
trusting their doctor and being
yeah,
like, okay, well, yeah, I'm having really, really bad morning sickness or
yeah,
whatever. And my doctor says it's safe. So I
yeah.
guess I'll take
I'll
it.
take it. And there are so many women who really were in positions who could not afford to be down with
Mm-hmm.
morning sickness because this is their third pregnancy or fourth pregnancy. So she's already dealing with a house full of children. The husband is
Mm-hmm.
off to work and earning, keeping a roof over their head and all that. She's dealing with so many children. She's like, I can't afford to be sick and down. So
Yeah.
if this pill is going to make me get through my day and be good to my kids for now, I'll take it. I'll
Mm-hmm.
take it. It'll help the whole family. And she has no clue that the much awaited newcomer to the family is going to
Mm-hmm.
have such an issue. Oh my
Yes.
God.
Yeah. Very, very,
Very deceptive.
yes.
Hmm.
So in the meantime, Dr. Murray, who is Francis's contact at the Merrill Company, is just getting more and more frustrated because Francis is continuously on this case. She is consistently filing the paperwork every 60 days to make sure the NDA does not lapse and get automatically approved.
Oh, wow. Good on her. Good on her.
Yeah, and she's been doing this for about a year now, even
Yes.
though the drug had been at this time approved in 46 other countries around the world.
Wow.
She is not
Wow.
letting it through.
Wow. Wow. What a
Yeah.
lioness. I love
Yes.
her.
Yes.
I love her spirit. She stood up. I mean, this is a
Yeah.
true warrior. She went out to battle. She
Yeah.
went out to battle. She is nothing less than a soldier who goes out and defends the borders with a
Yeah.
gun. She
Yeah.
is with her paper and her NDA and her making
Yes.
sure it doesn't lapse. She
She's
is a
on it.
true soldier for America and
Yeah.
American women. Awesome.
Yes.
Good on her.
And Dr. Murray kept on trying to go over her head too, and
Mm,
kept trying to go to her superiors and say she's being nitpicky, she's being unreasonable. But her superiors at the FDA supported her all the way. They were
good,
like, nope,
good.
yeah,
Excellent.
we're standing by her. By her delaying it and delaying it, by
Hmm.
now, reports had started to come in of an apparent
Ah,
worldwide epidemic of
yes.
babies being born with defects to their heart, urinary tract, eyes,
Oh,
and a condition
limbs.
called, yeah, a condition called phocomelia, which affected the limbs.
I didn't know about all the others. I knew about the
Yes.
limbs, that something was wrong with the limbs. What was it that was wrong
Yes.
with the limbs?
So, phocomelia is when the limbs grow abnormally short, flipper like appendages.
Yes,
So,
yes,
the
I
limbs
remember
are
now.
not like the arms and the feet are not fully formed properly.
And then, in addition to all that, they had others like heart defects and blindness or
Yes.
vision impairment and everything.
Yes.
Oh my God.
In the early 1960s, it's estimated that over 10,000 and potentially up to 20,000 babies born worldwide had physical defects, and about 40% of them died as infants.
Oh, heartbreaking.
I know.
I mean, all you do, and it's not like it's like such a high punishment for
Mhm.
doing something that seems highly innocuous when you do it. Like,
Yeah.
hey, morning sickness, I need to get through it because I have XYZ and my life is full of things. So
Mhm.
I can't deal. I don't have the bandwidth to deal with morning sickness. And you
Yes.
take it,
Yeah.
and the consequence is disproportionately high.
Yeah. And I think the thing that was even kind of worse was that the link between thalidomide and the birth defects wasn't immediately clear because
Oh no.
oftentimes the mother that takes thalidomide is perfectly fine. Like they get over
Yes.
their morning sickness, they're
Yes.
fine, they don't report any negative side effects. And then
Yes.
months later, the baby is born with these defects. And so linking it back to the thalidomide that you took months ago for your morning sickness
Is
was,
hard to, yes, yes, there is a
yes,
gap. Yes.
yeah,
And the primary ingester
hmm,
did not have any effects. It's the
yes,
secondary. Oh, well,
exactly.
hidden cost. Oh my goodness.
But after a while, it did become kind of clear that this is what was happening. And so on November 30th, 1961, Dr. Murray called the FDA and said that Merrill would be pulling thalidomide from the German markets and would no longer be pursuing the drug's approval in the US. And by March 1962, they had submitted a formal withdrawal of the NDA.
Wow. Wow.
So eventually, doctors and scientists were able to link thalidomide to the birth defects.
Okay.
And this is interesting. So, the first time I heard about the thalidomide crisis
Hmm.
was when I was taking a biochemistry class, and the professor was introducing the concept of chirality,
Hmm.
which is basically when a molecule can exist in two different forms that are
Hmm.
mirror images of each other.
Oh yes. Yes. Hmm.
Yes. So these are called the left and the right enantiomers,
Mm-hmm.
or R for right and S for left, because I
Mm-hmm.
guess for whatever
Yes.
reason they
Yeah.
decided to go with the Latin
Yeah.
sinister
Okay.
word for left chirality.
Okay.
But the point is that although the atoms that make up the molecules are exactly the same, the two enantiomers can have different properties.
Hmm.
And that is what was happening in the case of thalidomide.
Okay.
So the R enantiomer, the right
Hmm.
mirror image of
Hmm.
the version of the molecule, is perfectly safe,
Hmm.
but
Safe.
the S enantiomer is teratogenic, meaning
Yes.
it causes abnormalities during pregnancy.
Yes.
And so Merrill, the company, was selling a 50-50 mix of the
Aha.
S and R enantiomers.
Yes.
But actually, even if they sold it as just the safe R enantiomer, it's
Yeah.
been shown that the R enantiomer can convert randomly, I guess, to the
In
S
the body to
version.
the S. Okay.
Yeah.
Okay. All right.
And Frances actually caught that.
Hmm.
She had noticed that this property of chirality, that thalidomide could exist in these two different forms,
Hmm.
was not mentioned at all in the NDA
Ah.
filing.
Yes.
So it's missing from all of the reports that there's
Yes.
two different
So
versions
they are
of this
missing
drug.
the missing the
Yeah.
fact that the nerves are affected. They are missing the fact that there's chirality to the molecule. A lot of
Hmm.
key pieces about the molecule were missing in that NDA.
Yes. In July of that year, a senator from Tennessee,
Hmm.
Estes Kefauver, had been holding a hearing on drug prices and safety,
Hmm.
and he and his aides leaked the thalidomide story to a
Hmm.
reporter for the Washington Post named Morton Mintz. Mintz published an article about Francis
Hmm.
titled Heroine of the FDA Keeps Bad Drug Off Market.
Hmm. Hmm.
And this story basically went viral for the
Awesome.
Times. Francis was hailed as a savior, with the article saying, quote, Kelsey prevented the birth of hundreds or indeed thousands of armless and legless children, end
Hmm.
quote.
Yeah.
Although Frances insisted that the credit should be shared with her team members, Lee Geismer and Jiro Oyama, and her superiors at the FDA who had defended her, she still received most of the credit because of
Hmm.
her consistent documentation,
Ha.
both in requests for more data and for submitting the rejection papers every 60 days
In
without
time.
fail.
Yes.
Yes.
Awesome. Awesome.
Yes.
Wow. Wow. That is really good. That is
Yeah.
sometimes good things do happen to good people.
Yes.
It's nice.
Yeah. And I think what made it even more inspiring to the American public was that she wasn't the stereotypical, like, unsociable, tragic spinster woman scientist. She
Yes.
was happily married. She had two teenage daughters. She did
Yeah.
normal things. She had like
Yes.
friends over. She played
Yes.
golf and tennis,
Yes.
and she liked to spend time in her garden. She's
Yeah.
just like a normal woman who
Yes.
happens to be a scientist. And this is
Extraordinary.
mind blowing.
Yes.
Yeah.
Yes. And she
Yeah.
she saved she saved so many American families from
Yeah.
having to have the heartbreak.
Yes.
My God. I almost want to call her an unsung hero, but in this case, luckily, she did get the
Yes.
credit that was due to her. That is very wonderful.
And by the way, leaking the thalidomide story also turned
Hmm.
out to be a very smart political move by
Hmm.
Senator Kefauver,
Hmm.
because the public interest and pressure on the government to make sure a drug like thalidomide never came close to
Hmm.
getting on the market again
Yes.
led to the Kefauver-Harris Amendment, or the
Okay.
Drug Efficacy Act of 1962,
Hmm. Hmm.
which
Hmm.
required drug manufacturers to prove their drug was safe and effective before it could be approved. So, not only does the FDA have to approve the drug,
Yes.
but manufacturers have to prove
Yeah.
that their drug is safe and effective.
Yes. Yes.
Yeah.
Increase the onus on the manufacturers to show that you're
Yes.
not just packaging something and calling it
Yeah.
effective. Excellent. Much needed. Much needed.
And patients who were being given experimental drugs, like for clinical trials and such, now had to be informed of the fact that they were being given drugs that were not yet being approved by the FDA.
Ah.
So
Yes. Yeah.
that's also a
Go.
little piece that
Yeah.
very important.
Yes. Not eyes wide shut.
Yes, exactly. Senator Kefauver also nominated Francis to receive the President's Award for Distinguished Federal Civilian Service, making
Hmm.
her the second woman to win that award.
Nice.
President Kennedy said, quote, her exceptional judgment in evaluating a new drug for safety for human use has prevented a major tragedy of birth deformities in the United States.
Yes.
Through high ability and steadfast confidence in her professional decision, she has made an outstanding contribution to the protection of the health of the American people, end
Nice.
quote.
Wonderful.
Later that same year, the FDA underwent some major reorganization to
Hmm.
make two separate divisions,
Hmm.
one that handled INDs, or
Hmm.
investigational new drug applications,
Yes.
which a company has to submit before starting clinical trials in humans.
Yes.
and then a separate NDA branch, which
Yes.
handled approvals before going to market. In 1963, Francis was named director of the new investigational drug branch.
Hmm. Hmm.
The group was small. Francis oversaw 12 to 13 physicians that were all going through 2 to 300 IND applications a year. A few years later, Dr. James Goddard was appointed as the new FDA commissioner, and he really cracked down on drug industry regulations.
Yes.
He restructured the FDA again, and instead of having an IND branch and an NDA branch reviewing all the different types of drugs, they decided to have separate branches reviewing different types of drugs instead.
Okay. Okay.
So Francis was made chief of the Division of Oncology and Radiopharmaceutical Drug Products.
Hmm. Hmm.
So her work in radioisotopes came back
Yes.
around in handy.
Yeah, every piece is being beautifully stitched together so that
Yeah.
her expertise in all these different areas are coming
Yeah.
together to protect the American public.
Yes.
That is amazing. It's wonderful to see how slowly but surely these huge foundational pieces were put together to make the FDA so very strong, and
Mm.
having the FDA with teeth basically so that it could
Yes.
protect the American public. And it
Yeah.
is somewhat sad to see that the importance of that is been forgotten now in the current
Yeah.
climate. Many times for political clout, people
Hmm.
blithely talk about dismantling the FDA, getting rid of all the people who do all the
Yeah.
stuff in the FDA. They are talking about things like that today. And it's if you just can go back and tell people, hey, look at this, look at what the FDA did. They prevented thousands and thousands of deformed babies from being born
Yeah.
because they knew what they were doing, and they not only were the scientists knowing what they were doing, but they had politicians helping them to spread the word to the public,
Yeah.
and that way giving them teeth and saying, look, you can't just willy-nilly throw drugs at people and say, take it, it's safe. You can't do
Yeah.
that.
Yeah.
And that key message has been lost today, and it's really
Yeah.
sad to see. Actually, I'm very sad to see
Yeah.
that somehow, due to the various reasons, I don't know, is it maybe we have been safe too long and people have forgotten how it was to live in those days.
Yeah.
Everything has been so running so smoothly, and the FDA kind of greases the wheels and makes life smooth for all Americans very nicely, but quietly, without much
Yeah.
fanfare, doing its work
I think that's the
diligently.
thing. Quietly
Yeah,
without fanfare. It's
without
like we need
fanfare.
to we
Yeah,
need to
we need to
be
toot our own
we
horn
need
and
to do
say,
yeah.
yeah, we need to say, look what we did. But nobody does that. Scientists don't
Yeah.
do that. They are like, no, no, we rejected that bad drug. Yes, we approved that good
Yes.
drug, but within these
Yeah.
parameters, within these constraints. That and they do it so quietly and
Yeah.
efficiently. And the American public has been so well protected that it has
Mhm.
forgotten that the whole system is operating because of this wonderful safety
Yeah.
net which has been which has been given good teeth, and now
Yes.
slowly we are trying to declaw and de-teeth the FDA, so that is very sad.
Yeah. And that's why I think stories like this are so important to kind of show this is
Yes,
how it was. This is what
yes,
they could get away with at the
yes,
time.
yes.
And this is why it doesn't happen anymore.
Yeah,
Yeah.
if the FDA, like the onus is on the FDA, we used to be on the FDA to file papers in time, and if,
Mhm.
God forbid somebody fell down with something like COVID and the key
Yeah.
piece of paper did not get filed, boom, the drug got approved.
Yeah.
No,
Yeah.
that's not how things
The
work
whole
today.
system was hinging on one person to keep
Yeah,
filing that paperwork.
yeah.
If anything had happened to her,
Then that's it. She's out of commission, and the drug company was then able to take it forward. That's how it would have gone.
yes.
The American public has been very fortunate that she was right on the ball with that one.
Yes.
Yeah.
And we're very fortunate that the system is no longer like that, that if one
Yes.
person fails, the
Yes.
entire system fails. So,
Absolutely. No, no.
okay, so Francis was made head of the Division of Oncology and Radiopharmaceutical Drug Products. And according to Francis, because the group is now handling both INDs and NDAs, This is really the first time when the chemists, the pharmacologists, and the medical officers all started working together in the same office.
Hmm.
So this is something that I hadn't realized before, is that those three people who were in charge of the NDA, they all worked in different offices. So there was
Hmm.
no like, hey,
Yeah.
really quick, can you look at this graph, or really quick, can you do this?
Yeah.
She would have to
So a lot
actually
of
like,
things can fall through the cracks when that happens. Yeah.
yeah, she would
Hmm.
actually
Hmm.
have to make an effort to
Hmm.
go to
Hmm.
another building or go to
Yeah.
another.
Yeah. Yeah. And like, yeah, I'll get to him. I have to talk to him, kind of thing. And then it
Yeah.
never happens. Yeah. Yeah.
So she did this only for a short time before it came to their attention that amidst all of this restructuring, no one was really responsible for double checking that the data being submitted in the INDs or the NDA reports were accurate.
Oh
So
no.
if the data was falsified or if people were not carrying out their studies
Hmm.
according to standard protocols and then
Yes.
lying about it, people would end up back in that problem of the data looking really good and the drug getting approved. And only after it hit the market, people would start to see negative health effects.
Hmm.
So, a new department called the Office of Scientific Evaluation was formed to keep track of things like investigator trainings, patient consent, animal study ethics, and adverse drug reaction reports. And this was interesting because they helped form regulations and oversight committees around drug trials being done on prisoners and in nursing homes where drug
Yes.
investigators were almost definitely taking advantage of
Yeah.
people in kind of vulnerable
Yeah.
situations.
Yeah.
So Francis was in charge of that now,
Doing,
that,
bringing in,
yeah,
bringing patient protection, basically. Yeah.
yes. And
Yeah.
making sure that these studies were done ethically and that
Yeah.
data was not being falsified.
Yeah, and yet a big piece that has come now more recently, the patient privacy part, that
Mhm.
came much later.
Yeah.
Hmm.
So this is
Hmm.
still like the 70s or 80s, I think.
Hmm.
Like
Hmm. Yes.
how, how far we've come even since
Yes.
then. So
Yes. Even since then,
it's
we have
just mind blowing to me that some of these things like even had to
ha-
be like,
talked
oh, we need
about
to
or
do
said.
that.
Yeah.
Yeah,
Yeah.
we need to
Yeah.
make sure that like
Yes.
companies aren't
Yes.
falsifying their data. We
That's
should
right.
have a committee that oversees that.
That's right.
Yes, yes, you
It's
should.
like a duh obvious. Yeah.
Yeah, to
Yeah.
us it's
Yeah.
so obvious now, but
Yeah.
back then
Yeah.
they were like, oh wait,
Yeah.
people might not be
No, and
ethical.
it's funny because this is one of the reasons why the at the end of the whole process, I am grateful actually, in spite of being on the drug manufacturer side, I am grateful that these stringent regulations are in place so that
Yeah,
everybody is protected. The flip side of that is definitely the fact that there is a cost associated with it. By the time you have all these boxes checked and got everything lined up exactly the way it should be done, and do the testing correctly in animals and in humans, and do
hmm,
making sure that the data didn't get falsified, the cost of making that drug and getting it to the market does increase, and that is
yeah,
definitely one of the reasons why drugs are more expensive. So I often hear people say something like, making that aspirin didn't cost that much. Why are they charging me so much? Well,
yeah,
it's because of this kind of things. The
yeah,
actual effort to make sure that the little pill that you pop is
yes.
actually safe for you
Yeah, like one pill can take more than 20 years to get on the
to
market,
to
and
actually
it's,
make on the get on the
yeah.
market. But it's absolutely crucial. It has to be done.
Yes, it has to
Yes.
be. And in the process, thousands of similar drugs fail. Thousands of
Yes.
drugs fail this
Yeah,
process.
it's a huge funnel. It's a
Yeah,
huge funnel where so many
yeah,
molecules are tried and then one trickles through. It's not
yeah,
like it's not like software where you make an app or something, and if it
yeah,
fails, oh, it crashed and it killed my computer. No, if
yeah.
this crashes and burns, it's going to kill you. So sorry,
Yes,
we can't just let it go and you pop a pill because somebody says it's good for you.
yeah,
All
yeah.
right.
So Frances stayed at the FDA for the rest of her career. In 1994, when Frances was 79, a
Mm.
secondary school in Mill Bay, British Columbia, was named after her.
Hmm.
Frances was scheduled to go to the groundbreaking ceremony and give a speech, but the day before the ceremony, she was in a bit of a boating accident. So
Mm.
she was with family on a fishing trip
Mm.
when a large wave from a power boat
Mm.
hit her fishing boat, causing it to rock violently.
Hmm.
Frances was tossed up in the air and landed hard, fracturing her spine.
Oh, that's painful. Oh,
Yeah.
goodness.
She stayed overnight in the ER, but the next day she took some aspirin, we were just talking about,
Oh,
and some bourbon, and she went to the groundbreaking ceremony and
no,
gave her speech.
no way. What
Yeah.
is she? Iron Woman or something? Oh
Yeah.
my God. I would be curled up in a ball somewhere crying and feeling sorry
I
for
know.
myself. Wow.
Yeah. She's just like, nope, I'm gonna just take a little bit of painkillers, take a stiff
Wow.
hard drink, and go
Oh,
to that
a
ceremony.
true warrior. Man, she's so inspirational.
Yeah.
I really should learn to live life like that.
Yeah.
Wow. I'm so impressed.
In 2000, Frances was inducted into the National Women's Hall of Fame.
Hmm.
Although she suffered with back pain as a result of that accident, Frances stayed at the FDA until 2005
Hmm.
when she retired at the age of 90.
Ah,
That gives you something
love.
to aim for, huh?
Yeah, man. Yeah.
Yeah. I know you never want to retire,
I don't
so
want to retire.
yeah.
I like what I do. I
Yeah.
truly believe it's a passion. I truly
Yeah.
believe that making sure that the right drug is generated and it's given to the right people, it is important. You know,
Mhm.
we as human beings find so many ways to fight, and
Yes.
mostly people fight with each other, to finding various ways to find divisions between ourselves. But
Yeah.
these are the things to fight against cancer and fight
Mhm.
against these horrible diseases that are ravaging us, like Alzheimer's and things like that.
Yeah.
Fight
Why
those
fight with each
things.
other when we're
Why fight with
already
each
like,
other? Let's all get on one side and fight these diseases with
yes.
and make the drugs safe. That's the
Yeah.
fight we should all be engaged in.
I totally agree. Yeah.
I'm a warrior also. Sometimes I'm a
Yes,
warrior
you
too.
are. You
I'm a
are.
warrior and a warrior. But
Yes.
yeah, I am a warrior against diseases. So yeah, I'd
Yes.
like to fight
Yeah.
against these diseases like
Yeah.
Francis did, all the way till I'm 90,
All the way
if I
till you're
get there.
90 years old.
Yeah, or even more
I can
and
picture
beyond.
it. I can
Yeah,
totally picture it. You in a lab being like,
yeah, I'm
yeah,
fighting it.
I'm so
I'll figure
fighting.
this out. I'll figure this out.
Yeah.
Yeah.
In 2010, the FDA created an award named the Dr. Francis O. Kelsey Drug Safety Excellence Award,
Hmm.
which was established to recognize recipients for their outstanding accomplishments in this important aspect of drug regulation. In 2014, Frances moved back to Canada to live with her daughter in London, Ontario. And in August 2015, Ontario's Lieutenant Governor, Elizabeth Dodeswell, named her to the Order of Canada, which
Hmm.
recognizes outstanding merit or lifelong contributions to a field.
Nice.
Less than 24 hours later, after she received this award, on August 7th, 2015, Frances passed away at the age of 101.
Yes, yes,
Yes.
yes. She did.
Long, long,
She
amazing life.
she lived well and she did good by everybody.
Yes. And that is the story of Frances Oldham Kelsey, the woman who averted a major health crisis in the US. Yeah.
Wow, that was
Really an amazing
simply
story, right?
amazing. Simply an amazing story. A true inspirational woman, and
Yes.
everything she is, and she's a warrior in the same. I mean, I'm nowhere in that class.
I see a lot of similarities between you and her. And so
I,
I was
I
like, this is going to be a good one for my mom to listen to.
Thank you. This was a good
She's
one
really
for
going to
me.
like
I
this.
liked it
Yes.
a lot. Thank you.
Yeah.
Thank you for sharing this one with
Yes.
me.
Thanks for listening. If you have a suggestion for a story we should cover or thoughts you want to share about an episode, reach out to us at smartteapodcast.com. You can follow us on Instagram, TikTok, and Blue Sky at Smart Tea Podcasts and listen to us on Spotify, Apple Podcasts, YouTube, or wherever you get your podcasts. And leave us a rating or comment. It helps us grow. New episodes are released every other Wednesday. See you next time.